Colleagues, ladies and gentlemen, good morning. It's my pleasure to share with you this brief message during the first day of your conference on primary care and public health. Let me first thank Professor Majid and Professor Rawaf for inviting me to address you. Primary care and public health are at the heart of the work of WHO since its inception. Over the years, the wording or the vocabulary may have changed, but the values of ensuring access to health care for every individual and community, the values of fairness and equity, person-centeredness and participation have continued to be the same. What, however, has evolved is our thinking around health system strengthening, about improving access to essential services and extending financial risk protection. Our overarching aim in WHO is to help countries progress towards the goal of universal health coverage. We know now that universal health coverage, or UHC, is a critical target of the health-related sustainable development goal that countries have committed themselves to during the United Nations General Assembly session in September this year. The rapid demographic transition and the aging population, which is becoming a worldwide phenomenon, the changing epidemiological profile of most populations with high burden of non-communicable diseases, the rapid technological changes in all sectors, including health, the rising expectations of an increasingly informed population, and the increasingly important role of health in global governance and diplomacy. These are all developments that oblige us to be innovative about how we organize and deliver primary care and public health in the 21st century. These challenges are highly relevant to all regions. Ladies and gentlemen, the topic of this conference is of great relevance to the health challenges in all regions of the world, including my own region. Over the last 4 years, we identified 5 strategic priorities. Health system strengthening for universal health coverage is 1. Tackling the burden of maternal and child health is 2. Addressing NCDs, non-communicable diseases. Promoting health security and building capacity to meet the required competencies of the international health regulations. And improving the level of preparedness and response to public health emergencies. The point I would like to make is that primary health care is the core of each of these 5 priorities. I'm pleased to see that many of the themes of this conference are in line with our strategic priorities. And while we are making progress in all 5 areas, despite the challenges the region faces, I would touch upon a few issues and make some other points that may have relevance to the conference themes. The first other point I would like to make is to emphasize that health system strengthening for universal health coverage remains our overarching priority. The values of primary care are at the foundation of this work. The challenges are huge, yet there are also opportunities for countries to seize. We're expanding population coverage through prepayment arrangements, whether through social health insurance or tax-based revenue. And in this regard, we're particularly focused on expanding coverage to the large informal sector in our countries, which include the poor as well as the non-poor. In the area of service delivery, we've been working closely with several partners to promote family medicine as the basis for primary care. And here we're working to develop a framework for countries to address major challenges they face, including the inadequate number of family physicians being produced, the quality of training, retention, continuing education, and accreditation. The second point is in the area of non-communicable diseases, or NCDs. And this, as you all know, represents a major health problem in all countries of the world. 4 years ago, we had a breakthrough. An effective global movement on NCDs led to the high-level meeting of the heads of states and government at the United Nations in New York in 2011, and the political declaration they endorsed. This has provided a clear roadmap to countries based on sound vision and concrete evidence. We have now translated the political declaration into a regional framework for action that encourages countries to work across its 4 components: governance, prevention, surveillance, and healthcare. In the area of healthcare, the main focus is to integrate the management of common NCDs into primary healthcare. We have evidence-based and cost-effective measures that, if implemented, can result in a major impact in reducing the burden. But for the people with NCDs, health outcomes will depend on how the health system is strengthened, particularly at the primary healthcare level, to overcome the constraints that many countries suffer from in financing health services, ensuring access to appropriate technologies and medicines, addressing the gaps in the health workforce, and maintaining effective health information systems. These challenges represent the priorities of our day-to-day work with countries, and I'm sure that they will be the focus of discussion in your conference. Addressing these challenges require that we review international experience and best practices. It requires that we develop the right evidence-based options to guide policymakers, and it also requires building capacity in our countries. It is not possible in a few minutes to comment on these challenges, but let me just focus in my brief remarks on capacity building as a third point and highlight it as an area of work that should be a priority in every country. We know that there are significant gaps in public health capacity, which is essential for primary health care. A key question central to our work in WHO is how the countries can objectively measure public health capacity, how they can address the gaps, identify and address areas that need improvement and sustain strengths. And I have no doubt that this is an area that requires a great deal of attention. We're responding to this question by establishing 8 essential public health functions that are adapted to the needs of countries of my own region. This is not the first time that such an initiative has been undertaken. Indeed, it is the most recent of a series of initiatives. We have developed the framework, we now have the tools, and we have piloted these tools in 2 countries. And based on the lessons learned, we intend to scale up this initiative across countries of the region to help improve their public health capacity, which, as I said, is essential for a renewed focus on primary care. And exchanges of experience across countries and regions will be of critical value. Finally, coming from the Middle East and working to support countries in the region, I cannot conclude without mentioning emergencies and crises. And this is my last point. Providing effective primary care and public health in countries in acute crisis, and also in those with complex emergencies and prolonged conflicts, is a question that we face on a daily basis in our region. While we do have some experience from the region, a lot more needs to be done through collective thinking and scholarship, which conferences like yours should consider. There's absolutely no doubt that health systems need to be more resilient than they currently are. The experience of the Ebola crisis in West Africa is the most recent example, highlighting the pressing need of a higher level of preparedness and a more effective response in urgent situations. Communities caught in such situations deserve better primary care and public health, as these are exposed to higher risks. Let me close by thanking you again for inviting me, and I wish you all a successful conference and productive discussion on such an important subject.